The budget disappointed many in primary care because they thought the government had big plans. Well, we'll talk to one of the authors of one of those big plans, which, if they come about, will affect how you and I receive our healthcare from family doctors. The pandemic isn't over, you might have noticed, and there's still an enormous gap in the immunisation rates in low-income countries, and that affects us all. We'll talk with one of the people trying to refresh the funding for global immunisation this coming Friday. And painkillers and your immune system. Researchers at the University of Sydney have reviewed multiple studies from around the world, and they've found that common pain relievers have a tangible effect on our resistance to infection, which is sometimes bad, sometimes good. These medications may also reduce our responses to vaccination. This important piece of work may change how doctors prescribe and what you and I buy over the pharmacy counter. The lead author is Dr. Christina Abdul-Shahid in the University of Sydney's School of Public Health. Welcome back to the Health Report, Christina.
Thanks, Norman.
What was the nature of the studies you reviewed? I mean, were they lab studies? Were they real-life clinical studies where they were doing clinical trials, that sort of thing?
So what we did in this study is we actually looked at the evidence across all experimental settings, from lab-based research through to animal studies and also human clinical trials.
And what were you looking for?
So basically we were interested in seeing how these medicines, common analgesic medicines used for pain like opioid analgesics, antipyretic analgesics such as non-steroidal anti-inflammatory medicines and paracetamol, how they impact immune parameters in laboratory settings and animal models, but also how it translates into human studies and whether we're seeing consistent findings in the human trials as well.
I was just saying antipyretic means that they break fevers. It's you use it to reduce a fever.
That's correct.
What were the key findings?
So surprisingly, we found that morphine, which is one of the most commonly used opioid analgesics everywhere in the world, particularly in the post-surgical settings, actually reduces immune parameters that are involved in our innate immunity, so the first line of defense, things like the natural killer cells. And what that means is that it can potentially pose greater risk of developing infection or responding badly once an infectious disease has been contracted. And when we looked at human studies, what we found was there was in fact increased risk of infection with morphine and also other opioids such as oxycodone and fentanyl, which are also quite common. So it seems that the laboratory and animal studies are consistent with what we're seeing in human studies as well.
I mean, that's major, but it's unlikely with an old drug like morphine there's been randomised clinical trials. Is these just observational studies to see what happens when you give morphine versus maybe a historical group of patients who don't get it?
The majority are case control studies or retrospective cohort studies which follow participants over a period of time to see how whether they developed infection or things like that. But there has been some very small randomized controlled trials which have compared morphine to other opioids like tramadol, for example, in people with cancer. And what they found was that there is a slightly increased risk of infection with morphine compared to some of these other opioids.
What's the alternative? We'll come to the others in a minute, but what's the alternative given, I mean, it's almost standard operational procedure that you treat pain with a morphine infusion or an opioid infusion.
That's right. And basically it's too early to make recommendations about potentially suitable alternatives, but what we did find in our review is that opioids such as tramadol and tapentadol, which are sort of less classical opioids, if you like, seem to have less of an effect on the immune system, but I would also say that they were far less studied. So morphine was probably the most interrogated medicine in the group. And so what we need is future large studies to be able to really ascertain which of those medicines are suitable in the context of post-surgical pain management.
And some like tramadol can really knock you about. So let's go to vaccination now. This is really one of the most important findings, I think.
Yeah, so with vaccinations, what we found was that antipyretic analgesics like ibuprofen, like other non-steroidal anti-inflammatory drugs, can actually reduce antibody levels if used prophylactically. And what that means is that if it's used directly before a vaccination or vaccine is administered. And so what...
And is paracetamol one of those?
Paracetamol is one of those as well, and it's been especially studied in the context of child immunisation.
And what if you take it afterwards? You wait until to see whether or not you get symptoms, and then you pop a couple of Panadol?
Yeah, so we didn't find very convincing evidence from large trials to suggest that therapeutic use reduces the desirable antibody levels. So what that means is that if symptoms of pain or fever arise following a vaccination, it is okay to consider those medicines, but it's probably wise to use them if the symptoms are severe enough to warrant treatment.
But don't take two ahead of the jab at the GPs or the pharmacists.
No, definitely not to take them before vaccination, that's right.
And good news that aspirin could be quite useful for tuberculosis.
Yeah, so this was another surprising finding. Tuberculosis, just to give you an idea, is one of the most burdensome infectious diseases globally. It's the second biggest killer after COVID. And unfortunately, the organism that's responsible for this disease is becoming more and more resistant to our current best treatments, to the point where the World Health Organization has actually come out and said drug-resistant TB is one of the biggest public health crises that we face right now. And so aspirin was actually shown in animal studies to reduce TB burden. And when we look at human clinical trials, we actually saw that aspirin reduces the incidence of stroke and death. But it is important to note that the human studies didn't look at the effect of aspirin on the immune system. So there's still a bit of work to be done.
And finally, and this is also potentially good news, is that indomethacin, which is a very old-fashioned non-steroidal drug, it goes back a long time, might have an anti-COVID-19 effect.
That's right. So in vitro, so in laboratory setting, it has been shown to have some antiviral effects. What we need to do now is to see whether those benefits are seen in human studies, particularly the critically ill, those who might not be responding very well to the current best treatments. But there is a need to do a little bit of pre-work before we move into those large clinical trials and determine the best dose, the best timing of administration, so that we can really hopefully determine or give this potentially important medicine the best chance of success in COVID.
There's a bit of a track record there where you find response in the test tube, but it doesn't play out when you look at it in clinical trials, ivermectin being one of those examples. Christina, it's been a pleasure talking to you and very interesting.
Thanks for having me, Norman.
Dr. Christina Abdel-Shahid is in the School of Public Health at the University of Sydney, and this is RN's Health Report with me, Norman Swan.